At a basic level, the concept is simple. Insurance costs are directly linked to healthcare usage, meaning the more or less people use healthcare, the more or less expensive insurance becomes. Assuming you get your insurance through your job, there are several factors that affect your cost. But perhaps the biggest is how your specific company funds their insurance, fully insured or self-insured. If your company is what's called fully insured, it just means that your company, along with thousands of other companies, are all lumped together into one massive group. And how healthy or sick you and your coworkers are doesn't really affect your specific company's costs. This means that if the people at your company have low healthcare costs, you aren't necessarily rewarded. But it also means that if they have high healthcare costs, you aren't necessarily punished. This can vary slightly on how many people work at your company, but the overarching concept remains. Everyone pays collectively for how sick or how healthy the entire large group of companies is. On the other hand, if your company is self-insured, also called self-funded, your company isn't grouped with any other companies. So how sick or healthy you and your coworkers are directly determines your costs. If the people at your company have low healthcare usage, you're rewarded with lower annual costs because you all collectively used healthcare less. But it also means that if you and your fellow employees have high healthcare usage, you'll all collectively pay more because people have used healthcare more. There are a few other important factors that impact how much you pay for health insurance, so be sure to check the other videos in this series.